Alrighty. So good morning, everyone. My name is Gail Diedrich. I'm the nurse liaison for the school district of Palm Beach County, and I work with the employees to help them manage their chronic conditions. So today we are going to talk about, I'm just going to touch briefly on musculoskeletal disorders and give you a little bit of information about this order, and also some back for health information. So let's move into the next slide and get started. Alrighty. So we know that musculoskeletal disorders, referred to as MSDs, are a common and costly problem for people and companies across the United States. And musculoskeletal disorders are associated with high costs to employers, such as absenteeism, lost productivity, and increased healthcare, disability, and workers' compensation costs. So MSD cases are more severe than the average non-fatal injury or illness. And MSD are the single largest category of workplace injuries and are responsible for almost 30% of all workers' compensation costs. So it is important to be aware of it and know how to prevent it. The economic and human costs of MSDs are definitely unnecessary, and musculoskeletal disorders are preventable. All right, so to lay the foundation for an MSD prevention strategy, it's important to understand what MSDs are and what causes them, right? So with this knowledge, you'll be able to allocate your time, attention, and resources most effectively to prevent MSDs. So we're going to talk about poor ergonomics, and poor ergonomics can help to reduce or prevent musculoskeletal disease or MSDs, which are disorders that affect the muscles, the nerves, blood vessels, ligaments, and tendons. So some examples of these disorders may include carpal tunnel syndrome. You may hear your employees or your colleagues complain about tendinitis, rotator cuff injuries, epicondylitis, which is inflammation of the elbow, and muscle strains and low back injuries. These are some of the most common ones. And work-related MSDs are among the most frequently reported causes of lost or restricted work time. So let's forward to the next slide. So now that you know what a musculoskeletal disorder is, let's take a look at what may cause these disorders. So workers in many different industries, maintenance, transportation drivers, school teachers, custodians, or everyday employees can be exposed to risk factors at work. And some of these may include just lifting heavy items, bending, reaching overhead, pushing and pulling like heavy loads, working in an awkward with body postures, and performing the same or similar tasks repetitively. Next slide, please. So it is important to recognize the signs and symptoms of an MSD as early as possible to prevent serious injuries or permanent damage. So people at risk for MSDs may experience some of the following signs or symptoms. They may have numbness or burning sensation in the hand, reduced grip strength. They may have swelling or stiffness in the joints. They may have pain in their wrist, their forearms, their elbows, the neck, the back. They may have dry, itchy, or sore eyes, blurred or double vision. They may have aching and tingling, cramping, or just weakness. So although these symptoms may not necessarily lead to MSD, if experienced, you should make an evaluation of the type of symptom and your current work environment. So next slide, please. So why is it important to understand back? I'm just going to give you a little bit of background on it. So one half of all working Americans admit to having back pain symptoms, right? So back pain is one of the most common reasons for missed work. In fact, back pain is the second and most common reasons for visit to the doctor's office, to clinic, to your workers' compensation nurse, physician, and is outnumbered only by upper respiratory infections. And most cases of back pain are mechanical or non-organic, so meaning that they are not caused by serious conditions such as an infection or a fracture or cancer. So Americans spend at least $50 billion per year on back pain, and that's just one of the more easily identified costs. So experts estimate that as many as 80% of the population will experience a back problem at some time in their lives. And I'm sure we've all experienced back problems, whether it's for work-related or, just from exercising and just by turning and bending the wrong way, by lifting heavy objects, or just by doing our routine chores, right? So with those facts in mind, I'm sure you can see why understanding your back pain is important. And the back, you have to consider the back, right? So the back houses and protects the spinal cord as it extends through the body. And the spinal cord is connected to the brain, and it is part of the central nervous system. So the spine includes a spinal cord, nerves, ligaments, and muscles, right? So there are 24 separate bones in the spine, and they're called vertebrae, right? So ligaments and muscles that run down the front and back of the spine support the vertebrae. So muscles and ligaments help maintain the alignment of the back. So that's why it is very important to make sure that you take care of yourself. Make sure that you stretch, make sure that you exercise, make sure that you eat right, make sure that you take care of your comorbidities, meaning that if you have diabetes, if you have high blood pressure, if you have cancer, if you have any chronic condition or any underlying condition, it is very important that we take care of ourselves and maintain good posture, make sure that we stretch before we do certain things. I mean, we stretch before we exercise, right? So then we should stretch before working, before lifting heavy objects. We need to stand more. The average American just actually sit too much at their desk, and standing at least 3 hours, I want to say 3 hours per day more when we're on calls, when we are working, can burn up to over 700 calories per week. So there are advantages to just, taking different strategies to help maintain our posture or back and or prevent musculoskeletal disorders. So many back injuries are a result of, next slide, please. Many back injuries are a result of strain and damage over time, but there are certain motions and risk factors to be aware of. And among them are like having a job that requires lifting and carrying and pulling, twisting at the waist while lifting or holding like a heavy load. Many times when we do on-site events or when we're moving chairs for meetings, for conferences, and moving around tables, some simple tasks like that can actually cause musculoskeletal injuries. So be mindful, and definitely like working in awkward positions, poor body postures, or chairs, the way we sit, the way we place our feet, the way we stand, using a particular muscle group for long periods of time without relief can cause MSDs. And back injury, weak back and abdominal muscles, being overweight and inactive, and eating the wrong diet. Diet is very important to prevent like obesity, to keep our bones and our joints healthy. So all these actually play a risk in preventing back and musculoskeletal injuries. Next slide, please. So, to help avoid back pain or problems, you may want to follow the following practices. So, like I said before, maintain a healthy diet and weight, stay active, maintain proper posture, wear comfortable low heel shoes, sleep on a mattress of medium firmness to minimize a curve in your spine. Lift with your knees, keep the object close to your body, and do not twist when lifting. Quit smoking. I can't emphasize how smoking is bad for your health on all levels, right? Smoking impairs, remember I told you before, smoking impairs the blood flow, resulting in oxygen and nutrient deprivation to spinal tissues. So you need to work with your doctor or your chiropractor to ensure that your workstation is ergonomically correct. All right, so I'll review these techniques to help avoid back pain. Over the next slide. Next slide, please. Okay. So, where can you go to help find your back pain? So you should always see your primary physician, right? Your primary physician is your go-to person. Finding a United Healthcare Premium Designated Provider is very easy. Log on to myuhc.com. You can click on Find a Provider, and it is easy to find. You have resources. You have myself, you have Farah, you have Shanti, you have Carly, and you also have Charlotte at the district who can actually help you and lead you in the right direction. You can also call the Advocate for Me line at United Healthcare, and they will actually connect you with a nurse that can help you find a provider, will help you work through your musculoskeletal disorders and connect you to the right resources within your network. So next slide, please. Alrighty, so areas to address when stretching. When you're stretching, you should always stretch your neck, your back, your arms, your hands, your fingers, legs, feet, and definitely your eyes. We sit at the computer way too long to just staring at the computers, doing meetings, especially now being virtual. And that will cause eye strain, and the glare from your computer can actually cause injuries. So it is very important to get your screenings done, make sure you get your eye exams, make sure you take breaks, get up and walk away from that computer a couple minutes, and make sure that you are not sitting there for hours. Stand while you're on conference calls. Stand while you're actually in meetings can help the blood flow to the different vital organs and to the different areas that can help prevent injuries. So moving on to the next slide, I just want to just do a quick cap and pass it on to the next person, since we have, I'm almost at the 60-minute cap, and I'll leave 4 minutes for Q&As. So tips to remember: ergonomic hazards may lead to musculoskeletal disease, and early recognition of hazards, as well as signs and symptoms of disorder, is crucial. Ergonomic hazards exist in all workplaces, right? So you always stretch before, during, and after work, and consult your primary care physician when starting any exercise regimen, or if you feel you're experiencing signs and symptoms of MSD. And with that, I'll just leave it with the health resources. You can always, like I said before, reach out to one of us. Log on to myuhc.com. There are many information out there on Rally that you can use as resources that will help support you. And of course, always reach out to myself or the on-sites. So with this, I will just stop talking right now and pass the ball to the next presenter.
Okay, great. Thank you so much, Gail.
No problem.
And next, we're going to have Ann Holness from Select Physical Therapy. Select Physical Therapy manages our workers' comp claims, so we wanted to bring them on today to talk about what they see in our employees and give us some tips.
Hi, good morning. My name is Ann Holness. I'm a physical therapist. And my position here, while Carly is bringing up the PowerPoint, I'm working with Select as a work strategist coordinator, meaning that I administer, coordinate anything work comp related to the Southeast Florida area, including Palm Beach, Broward, Miami, and Jacksonville markets. Today, I'll be talking about just what Select and how we're involved with the partnership with Palm Beach schools. Next slide. Select Medical is a leading provider of specialized healthcare in both inpatient and outpatient settings. It was founded in 1996 by a physical therapist, and we provide services to more than 1,600 clinics throughout the states. We provide long-term acute care, the inpatient rehab, outpatient, and occupational medicine. Next slide. As I said, we're in about 1,600 clinics throughout the states, and we have about 120 locations in Florida. And in South Florida, we're throughout the Southeast Florida market. Next slide. In Southeast Florida, we go from Tampa to the Keys, in charge of the market from the Keys to Port St. Lucie, and then the Jacksonville area. So we provide all kinds of outpatient therapy, both hands therapy, specialized hands therapy, occupational therapy, and physical therapy. Next slide. In the Palm Beach County, we have 6 locations. We have in Forest Hill, East Boca, West Boca, Jupiter, Wellington, and Royal Palm. And I've seen some of the employees who live in the Port St. Lucie area. We also have a clinic available there. Next slide. What's differentiating us from the other companies is that we have licensed clinicians seeing all the injured workers. We do not use technicians or massage therapists, or we only use licensed professionals. We provide continuing education. Each clinician is supposed to be to have their continued education and renewal of the license. We do that. We have provided a lot of courses internally, and we also offer tele rehab for the injured workers who are not able to come to the clinic, especially during COVID, with lots of injured workers not being able to access the locations. Then we were able to provide the tele rehab to not only injured workers, but also to other patients. As I said before, we provide physical therapy, hand therapy. We have specialists in concussion, vestibular therapy, any kind of dizziness. We do aquatic therapy at certain locations. We work closely with some schools to provide sports medicine, whether it be with the athletic programs. We do on-site injury, meaning that we go on to employers, the jobs themselves with employers, and we teach injury prevention. If there's any kind of injury, instead of being they going out to the work clinic, we see the injured worker on site to determine if it's injury that has to be seen by a medical doctor for x-rays, or if it's just the musculoskeletal injury that can be addressed immediately with therapy. We do employment testing, where I talk about later on. We do workstation assessments, not only with office administration, but we go into the different departments, whether it be custodian or the material handling, and we observe what what the employee is doing, and if there's any behavior modification we can advise them on, or if it's any special like ergonomic tool that can be made to have improve the safety for that employee. We do it one-on-one. We do it with the a whole department. We also have work-related therapy, meaning that we work closely with Palm Beach schools. So with their injured workers, when the injured workers come for therapy, we already have their job description. So we are able to treat them and make sure that they're able to return to work safely based on that job description that we have for that injured worker. Next slide. As I said, we treat muscular ligaments, disc, bone. We do specialized pelvic floor issues for both men and women. We see amputations, post-COVID symptoms. We have basically worked with the CDC to develop a program we call rehab and rehabilitation post-COVID, where the patients who have had COVID, who have had so many ailments like either dizziness, they have weakness. We have a program especially for those post-COVID patients. We have cancer programs, Parkinson's programs, chronic pain, and work-related injuries. Next slide. We in 2015, we partnered with Palm Beach schools and did a physical abilities test, which is called a POET for short. It's a post-offer employment test. Once Palm Beach School decide to hire an employee, based on their position, they will send that employee to one of our clinics, and we will test them to see if that employee meets the requirements for that particular job. It helps to make sure that the person is safe, meeting those job demands, and it helps to prevent future injury. Next slide. The jobs requiring POET tests right now are the behavior intervention associate, the behavior physical needs associate, the custodian, food service, mail courier, the material handling, school bus attendants, school bus driver, OT, PT, and the assistants, and warehouse tech, meaning that any of those offers that are presented to a candidate, they first have to, after doing their background check, the physical, and they are offered a position, before they can start work, they come to one of our clinics with an offer letter, and we do a test, which is a physical abilities test, based on the job description to determine if that particular employee is can meet that job demand. We first go through a medical history with them, make sure they are safe. We take blood pressure, we do a musculoskeletal test, and then we do what is considered a job-specific task, where it's specific for either the custodian or whatever position they're hired for. Next slide. The common injuries we see with the Palm Beach schools is sprains and strains, whether it's be the back, the shoulder, the knee. We see slips and falls affecting mostly the knee, ankle, and back. And when we've worked closely with the case managers, the Sedgwick group, and any issues that may come up while we're treating those injured workers, we reach out to them to make sure that that injured worker gets the treatment that they require. If, for instance, they've been seen in therapy, but we see that they may need further medical intervention, then we'll reach out to the case managers and the doctors to recommend further intervention. We also determine that if that injured worker has gotten to a certain point where they have met all the range of motion and strength, but they need further strengthening, like for instance, a position like custodian, which is a heavy physical demand level, then we may recommend them to do what we call a work conditioning program to get them strong enough to get returned to work full duty. Next slide. Currently, we have 12 cases for the Palm Beach School. In my position as work strategist coordinator, what I will do once a month, I will pull up all the injured workers in our system throughout the county, and I will send that information to the case managers to just give them an update as to who we have currently being treated in our clinics, what their injuries are, and if we need any further, those injured workers need anything further. For instance, if they ready to go back to work, if one has gotten to plateaued and gotten to their max improvement and may require what we call a functional capacity evaluation. And so we send that information to them and communicate constantly with them to let them know how their injured workers are improving. The cases may be surgical or non-surgical. Currently, we have like 5 upper extremity, meaning the shoulders. They are either shoulders, wrist, or elbow. We have 3 lower extremities with the knees and the ankle, and 4 back. So we see various injuries. It's not only one specific diagnosis depending on the position. We see teachers, we see subs. We find that a lot of the subs may have slips and falls. That's why we encourage the employees to wear proper footwear. Some of the injuries may be where the employees are reaching in awkward positions. You find that that's a lot of behavior modifications required, reminding the employees that certain positions they're reaching for to make sure they're always safe when they're reaching, when they're lifting, when they're bending, that they always maintain that proper position to decrease the risk of injury. And next slide. So our focus, even with the injured worker and even when we're doing the pre-offer employment tests, we always emphasize prevention, because research shows that most injuries can be avoided and that they're behavioral, meaning that an employee may reach or twist or wear improper shoes. So we encourage employees to avoid abnormal movements whenever they are lifting or reaching, that they face the objects. They don't overreach, they don't twist, and important to remember to wear proper shoes. Next slide. And any questions? I'll take questions when you're ready.
Thank you. And I think it's a great topic. I don't think that unless you've been injured as an employee, I don't think you necessarily understand this part and what the role is that select physical therapy has for our employees. We hope that you, if you have not experienced it, that you never have to, but just knowing that there is support there for you and they do their best to get you back to work as quickly as possible. And then, of course, teaching you how to prevent it from happening again, right?
Yes.
Okay. Excellent. Thank you so much, Anne.
You're welcome.
Okay, so now we have with us Dr. Kesey, who is going to talk to us about some injury prevention recommendations.
All right. Thank you guys for having me this morning. I am Dr. Corey Kazee. I am a chiropractor. I'm also a certified strength and conditioning specialist. That certification has kind of helped me out with some of my collegiate and professional athletes that I work with to better help them reach their performance, movement, health, and wellness type needs. So we're going to get into I'm going to kind of discuss, what it's like coming into my office and some things that I look at when somebody comes in, whether they're in pain or not in pain, just doing a wellness checkup. So if we could go to the next slide, Carly. So keys to preventing injury, and there's mainly, 3-4 things that I look at. The first and most important is good movement patterns. And then we start to go into your overall lifestyle. So we take a deep dive into how you're sleeping at night, how much sleep you're getting, what are your stress levels like, your day-to-day activity, what are you, as far as nutrition goes, what are you putting into your body, what are you eating, what are you drinking, so on and so forth. Next slide. So we'll start with good movement patterns. So this picture on the right-hand side of the screen here, this is a concept that I utilize in my office. It's called the joint by joint concept or joint by joint approach. So you start all the way down at the bottom, work your way up, or vice versa. But every single joint either has a function of mobility or stability when it comes to your overall biomechanics. So you can see everything listed here on the left is supposed to be a mobile joint. So your toes, your ankles, your hips, the upper back, your thoracic spine, shoulders, the upper neck, so we can look fully side to side. And then everything on the right-hand side is more for stability. So your lower back, middle neck, the shoulder blades, the lower back, the knees, the feet. So what happens is, there are movement screens that I can perform when you come into the office, and it kind of detects any potential areas of concern or movement faults that you may have with your biomechanics. So what this does, it gives us a good baseline of where you are and where your overall function is. So the problem we run into here is, let's say, let's take the knees, for example. The knee is supposed to be a stable joint. So if you come into the office and your knees are mobile or they're moving all over the place and they don't have that stability, that's a good sign. If you're not in pain already, you're probably going to have knee pain later on down the road if we don't correct that issue. I have listed over here, repetitive stress without recovery or correction is ultimately going to lead to injury. So if you have an area of weakness that you are just constantly using day in and day out, you're causing repetitive stress, and that area is going to ultimately break down and injure itself. Whether it's, the lower back, you're ultimately going to herniate a disc, or, the knees, the hips, the ankles, as far as, spraining the ligaments or straining the muscles in that area. Many minor injuries can be avoided with the proper detection and then the proper correction. And then, like I already stated, performing a movement screen, it really helps us determine your areas of concern. So I utilize this on everybody, especially, the athletes that I work with. It gives us this baseline. I can see where they're at. And if they do, have a freak injury out on the playing field, it lets me know where I need to get them back to as far as a rehab phase and rehab process before I can, approve them to go back to the playing field or go back to, for, people who aren't athletes going back to work. It gives me an idea where you are now that you're injured and where we have to get you before you can go back to functioning at 100%. Next slide. So lifestyle, we dig into sleep. I love talking with people about sleep. A lot of times it often puts them to sleep. It is a boring subject to talk about, but what happens is, when you fall asleep at night, that's when your body recovers. That's when you re-energize, you refuel, so to speak. If you're a gym goer or if you're real active during the day, lifting boxes or going from sitting to standing, sleep is when, those muscles relax, those muscles rejuvenate, your body gets some extra blood flow and, you repair and recoup for the next day. And then we also dive into your stress levels. So, high stress, people who are, extremely stressed out with work or if there's, family issues going on, you name it. We see a correlation with stress leading to, muscle spasm, exhaustion. If you are just completely stressed in and day out, it's ultimately going to, break down your body. And cause some weak areas that'll ultimately lead to an injury. So we highly recommend, let's find those stress triggers, what's causing the stress, and then let's find some activities to do to, minimize that stress. So whether it's yoga, getting a massage, a favorite hobby or activity that you love to do, to just minimize that. I can tell you it's crazy when patients come into the office. A lot of times, people always tend to get hurt right before they go on vacation for some reason. So they come in and see me and we're working on them and they're worried. They're like, what am I going to do? I'm going to be out on vacation. I'm like, listen, you're probably going to feel great because you're not stressed about work. You're not stressed about, finances, family. You're going to be on vacation, having a great time. Sure enough, when they come back the next week, they're like, Doc, you were 100% right. That's crazy. So there is a strong correlation between high stress levels and the pain, and the exacerbation of the pain that you're carrying around every day. Next slide, Carly. All right. Lifestyle continued. So nutrition. Nutrition is a huge factor. What we put into our bodies kind of equates to what we get out of our bodies. So eating a well-balanced diet, we often see that, high inflammatory foods can lead to excessive joint pain, especially in those of you that already have arthritic or arthritis type conditions. If you really pay attention to it, if you're eating mainly fruits and vegetables, kind of get a good feel of how you're doing and how you're moving around. And then if you have a weekend, where you're watching football, eating pizza, having some adult drinks, things like that, you'll kind of notice that your body and your joints may feel a little sluggish. And that's because there's a correlation with what you put in your body. I put this little fun fact here from a research article. So for every 4 pounds you lose, you remove 16 pounds of pressure from your spine. So people who, are either overweight or considered obese, one of their main complaints is lower back pain. So it's really a matter of managing, that weight that the spine is carrying. In one study, the risk of developing osteoarthritis dropped 50% with each 11 pounds of weight loss as well. So with that being said, that's not telling you to go out and everybody lose 11 pounds of weight. So that's why I put on here, consult a dietitian or a medical professional before you start any kind of diet. It's not for everybody. There's different mechanisms for different injuries. And every person is unique in what is potentially causing their pain. Next slide. So these are some of the most injuries and conditions we see in the office, especially from, educators, teachers, people in your field. So we get a lot of headaches, a lot of neck pain, shoulder stiffness and tightness, especially in the, trap areas. We get a lot of lower back pain, sciatica, and then also wrist pain and carpal tunnel. So, again, preventing those, I think you guys have already gone through a presentation, but, ergonomics play a huge role in preventing a lot of these injuries, as well as, proper bending techniques, sitting techniques, and proper posture when you're at your desk or teaching. So next slide. So best plan for prevention and recovery. So my biggest recommendation is add wellness visits to your medical routine. So you probably go see a dentist twice a year. You go to your medical doctor for annual visits, or if you have other medical conditions, you may see them more frequently. Add seeing a chiropractor or physical therapist in there once a month or once a quarter. What it does is it just allows you, you can get that movement screen, you can get that baseline, just make sure everything is in check, everything is in alignment to prevent those injuries. See a massage therapist, consult with a dietitian. Again, it'll, relax the muscles, reduce some of that stress. So, adding a wellness side to your medical routine is really key for prevention. The other thing too is, information is always changing. So, stay in the know with the most up-to-date information. I spend most of my time, if I'm not seeing patients or doing paperwork, I'm nose deep into research articles, medical journals. I'm taking classes outside of work, constantly updating myself with the latest, greatest knowledge and techniques that will, better help me treat the people that come into my office. So, 5 years ago, the information 5 years ago, or even a year ago, may have changed in the time that, you were last at a chiropractor or physical therapist's office, even a massage therapist's office. And then, if you are feeling pain or you are injured, you need to start the recovery process right away. So, don't wait to see somebody. I think we're all guilty of it. Even myself, you feel a little twinge in the lower back or a little bit of knee pain. Let's take some ibuprofen. Maybe it'll go away. And then a couple of weeks later, it's, the pain comes back. So just get into, a professional who can take care of you and address the issue right away. Injuries are much easier to correct in the acute stage versus the chronic stage. So, acute versus chronic, if you get into us within the first week or two, that's beautiful. But if you wait months and months and months to come in, it takes a lot longer to correct the issue and correct the pain that you're having. We can get you out of pain. We can correct that mechanism of injury, and we can give you the proper rehab plan to prevent that pain from reoccurring. So the last thing we want is for you to, fall into a cycle of every, 2 to 3 weeks, you're blowing your back out, or every 2 to 3 weeks, you're having real bad migraines for a week. So we can get ahead of those issues, correct them so that, you can live life pain-free. That is, I believe it. I think, Carly, what's the next slide? The question slide? Yeah, so I'll leave it open to any questions. I'm sure I'm going to have a lot. So we'll see.
Thank you. That's very good side to see and learn about our injuries. I think we had a great panel today, kind of tackling every area, like the medical, and we have allied health with Anne and with Dr. Kazee, as seeing it's not just our primary doctor who can help us. We need to get help. The worst thing that we can do is not get help for our injuries, right? And let it go for months and years. And there is help out there. So it's great to kind of understand the different parts of, of what you all do. And I think that sometimes it's not always known, what everybody does and what Gail does for our employees. So I think that was very helpful to kind of hear the different sides of it. So I appreciate all of that. We did have a couple of questions. Do there was the facts, Dr. Gazita, of the weight loss and then the pressure off of your spine. If you could provide the link to the study on that, that would be
absolutely.
great.
Absolutely.
Yeah, 'cause I
if
think
they
that's-
want to, I see Amanda's too. So if they want to drop their email, I can write it down. I can send them those research articles.
Absolutely. Absolutely. I know that our dietitian does talk about high inflammation foods as well. We talk about that with arthritis a lot and inflammatory foods. So that would definitely be a good article to learn more about. Are there any other questions?
Dr. Casey, they would like your information. I went on your site. I don't know the contact phone number or
You
email
can
address.
actually, you can give out the office number should be on there, right?
The 733-7772.
Yeah.
Okay, perfect. Thank you.
I have a question. What is a good stretch for sciatic?
One of the so are you going to be here on Thursday?
Yeah, that's a good time to talk about that.
Because the reason I say that is I have probably 3 or 4 really good ones for sciatica that I have in my presentation ready to go on Thursday. But I can, if you want to reach out if you won't be here Thursday, we can always set up a time to talk, and I can show you those.
Absolutely. So Lynn brought up a good question. You mentioned losing weight, but when your back is out or you're feeling pain, what exercises would you recommend? I mean, we could also talk about this on Thursday, but it's hard when you have, pain and then you're trying to exercise, right? To maintain your health or to lose weight. What are your recommendations?
Yeah, for me, it's that's a hard one. That's a tough one because you obviously don't want to push through the pain and injure yourself further. So it's one of those things where we kind of have to rehab you first, and then once we get you to that stable baseline, then we can start implementing the exercise again. So yeah, it's a tough one because you can't really go full out in the gym when you're, having real bad back pain and sciatica. The other thing we can do too is, we can modify the exercises that you're doing. So, let's say you're doing exercises with weight or weight bearing exercises. Maybe we can take the weight away. So you're still getting some type of exercise technique in there, still getting your heart rate up a little bit. And then you can still perform that without the weight pain-free.
Anne or Gail, did you have anything to add to that regarding being in pain, but also working towards weight loss?
Yes. What we do in the clinic, we do assessments because a lot of time that sciatica may come from various ailments. It may be the back, the pelvis. So we'll do a full assessment to determine what's causing that sciatica, and then treat that, get that pain down, do the strengthening, and then always give a home exercise program gradually. And we also advise in making sure that they have proper nutrition, which is very important. 80% of weight loss is the diet. So we emphasize that, and we make give them constant education as to what they need to do to better improve.
Gail? Thank you. You're on mute, Gail.
Okay. So one thing I will always encourage is definitely stretching. That's one of the best things that you can do to prevent injury. The same goes for avoiding injuries at work. So if you work at the desk, or if you work out in the field, or, if you work, in the office, in the cafeteria, or you're a custodian, you can almost always think of similar ways that you can avoid injuries. So you should always stretch before and after lifting weights. And as I know what you're thinking that maybe you sit behind a computer during the day and not, lifting hundreds of pounds. each day. So as we have talked about previously during this panel, there are ergonomic hazards just working at your desk. So stretching your hands, arms, neck, and even getting up to move around each hour may effectively help you avoid conditions such as the carpal tunnel syndrome or the sore back. You should always stretch your neck, your back. I echo everything that everyone says. And one thing you should try as a work practice control is probably getting your coworkers together in the morning before work and have a stretch and flex session each day, and have a new coworker lead it each day and keep it interesting. And this may help to avoid musculoskeletal disorders while also connecting you with your coworkers.
Absolutely. And so Thursday, it's going to be recorded. So if you miss it, then you'll be able to catch it later. But Dr. Kazee and Ann will be giving us some exercises to do to prevent pain and also, keep our body healthy. So that should be fun. Be prepared to come with some sneakers if you can when you watch the video or attend the session. So I think that will be a fun activity for us. Light exercise. It's not going to be, you won't sweat, just some general stretching we'll be doing and some exercises that you can do at your desk. Tomorrow we have, I think a few of you Gail captured a little bit more about the workstation and what your workstation should look like. But we're also going to be talking about not just those of us who sit at a desk, but your workstation could be the seat in a bus. It could be, out working outside of the schools for our maintenance group. It could be a teacher who's standing all day. So we're going to be talking about that tomorrow, is how to make your workstation, work well for your body. So that will be covered tomorrow. And then Friday, a few of you Ann mentioned the slips and trips. And part of that is because of our footwear. So we'll be talking more about proper footwear on Friday for all of our employees. So are there any further questions? This has been a great hour full of lots of information. We truly appreciate our special guests today. Are there any last minute questions? And you also have the information to contact each provider separately if you have some individual questions.